Hello guys, so I thought I'd do a video today, and this video will be for kind of educational. This will be the post-transplant medications and what kind do you take post-transplant. Some people take different ones, and so yeah, I will also be showing you what I take and how I organize them as a blind person. First of all these medications, I brailled them. They're all in this box here, which was sent home with me when I got discharged. And basically, I've learned the feel of all of my medicines. So basically what I do is I just braille them, because I braille them anyways, just because I don't want to be shuffling through, opening up each medicine and filling it when I'm trying to fill my organizers. Because, you know, when you're in a hurry or something, you don't want to be doing that when all I can do is just read the braille. So let me get started here. Let's see. The first one I'm going to show you is the anti-rejection med. It's called Neural or Cyclosporine, or I'm sorry, Cyclosporine. And this medication you take 12 hours, every 12 hours basically. 12 hours a day. I take mine in the morning and also in the evening at the same time. And also, one important thing to note about this medicine is you have to take it 2 hours before you get your blood work done, because what will happen is that's how they measure the level, and you do have a 15-minute window on either side of that medicine. So those that take it will be getting two sizes. This small one here is a 25 milligram, and I basically have been cut down to 3 25s a day, which totals 75 milligrams. And this big one is 100 milligrams. And I will tell you, if you cannot take these out of the foil until you actually are ready to take the medicine, because what will happen is it will make it not as effective. So if you use a pill organizer or a pill dispenser, you cannot use this medicine in there, because it's too big for a dispenser, or actually I've never seen a dispenser, but it's too big for a pill organizer when it's in the foil. So that's that. And it does smell exactly like a skunk. A lot of people call it the skunk pill. Okay, and then we got this medicine I don't take anymore. It's an as-needed medicine though. It's called Colace. It's basically a stool softener that you take, especially when you are new in your thingies, staples, I want to say. When your incision is healing, you cannot strain your bowels. You cannot strain, basically. So you have to take this if your bowels are hard, or you know what I mean. So that's that. Let's see here. We have this one I don't take anymore either. This Percocet. it's just basically after surgery pain and all that. I still got it, but I don't take it anymore. I don't want to throw it away because some druggie or somebody might be, I don't want them digging through the trash can and say, oh look, here's some pills. And so I don't know if there's a proper way of disposing of those or not. I know you're not supposed to dump them out of the toilet either. Now this is called KPhos neutral. This is for if you have low phosphorus. This is the one that I mentioned I was having trouble with getting it changed, and I found out my insurance doesn't cover it actually, so I don't take this one anymore. It's on hold. They're going to look at my actual next lab whenever they draw the phosphorus again, because I may not need it anymore, and they will go from there if I do. But I found out what it costs. It costs $50 out of pocket, which I can afford that because I have a good job. This one, let me see here. This is another anti-rejection med. It's called Rapamune. It's basically shaped, they're little heart pills. They're shaped like little hearts, and it's for rejection. And I take that 4 hours after I take my other, because you cannot take them together because there'll be a reaction to this if you take them with your other anti-rejection. So you have to make sure. And this one I take about noon. This one I only take once a day. And let's see what else we got. This is called Valtrex. What this one does is there is a virus called the CMV virus, and it's basically like the virus that you get when you get the chickenpox. After the chickenpox are gone, it lays dormant in your system, and as we all know, that one reactivates as shingles. So they got me on this because just to protect me in case I had it, or I could also get it from the donor as well. And this is Zofran. This may look familiar to pregnant ladies. The Zofran, it's basically helps with nausea and vomiting, and it's an as-needed drug. And basically what the valves, actually this Valtrex here, I forgot to mention, I take it once a day too, and it may not be for life. The rejection meds are for life, but these other pills I'll eventually come off of those probably. Now the Zofran, there's another drug out there called Finasteride, but the second time I took it I had a reaction to it, so Zofran is more expensive, but I switched to this. Plus it works better in my opinion than Finasteride anyway, because Finasteride really did not do anything for me even before I had the reaction. And then we have, let's see what this is, Pepsid, and that's just basically it. Helps with the acid that you can get from the medicine, all the medicine, and I take this once a day too. And let's see what else we got. This is just regular baby aspirin, and I take this once a day. This will also be for life. It basically helps the arteries in the kidney not to clot off. So it's I take it once a day, and plus everybody should be taking aspirin anyways once a day because it helps with the heart and everything. This one is another Rapamune. which I already showed that. And then I got one more. This one is called Nystatin. It's a liquid mouthwash, and I come off of it. I got one more month left on it, but basically you swish it around your mouth after every meal, and it helps with bacteria. And let's see. Oh, there's another one. One more I forgot to show you. This one is called Bactrim. It's basically, it feels like a piece of chalk. It's just another antibacterial pill that I take once a day. Alright, and I'll show you. This is my pill organizers. They basically are the ones with where the first letter of the day of the week is Braille. They got 5 days a week on them. And basically what I do, I have a few of these. I just put a Braille label for morning, afternoon, or noon and evening on these organizers. That way I know what I'm taking, when I'm taking it, and so on. And I do fill these up periodically with the medicine bottles that are in here. Alright, so it's been 2 months post-transplant. It's hard to believe that, but everything is going good so far. And as you all know from my Facebook posts. And yeah, if you have any questions for me, please let me know. And we'll see how this turns out. This is my first video on my iPhone, which I think all blind people should have, because it's really awesome. And yeah, so I'm one of the few that didn't have one until recently, and I'm glad I got one. Alright, well, thanks for watching. Bye.